The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're at the first Friday in December. It's hard to believe that we just flew through the year, and for many of us, we're kind of really glad that 2020 might be over because it's been an interesting year, to say the least. And I am really proud to really have back on the show Mr. Rich Crislip. Rich is part of OptumCare Arizona. He's the Director of Behavioral Health for OptumCare. And I've also got here on the show today, I've got Dr. Amar Kapur. He is a primary care physician at 4C Medical Group. And Amar, it's really great to have you here on the show. Welcome to you both, Rich. And can I call you Amar?
Yeah, sure. That's fine. Amar.
Sure. Welcome both to the show. It's good to have you. In this day of technology, we are doing this via the phone lines, and we are also using video conferencing. So I can see these two fine gentlemen, and I'm also able to bring them in with clarity on the radio show here today. So what I want to do today is I want to talk to Amar first in the first segment, and then the second segment I want to bring in Rich. So in the first segment I want to dedicate to, we're a couple days late, but the month of November was Diabetes Awareness Month, and I want to talk about diabetes because diabetes is something that is really, really, it's an awful disease, and it's one that we need to draw awareness to, and we certainly want to make sure that we are not only drawing awareness to, but also making sure that we're preventing it. And certainly here today, I want to talk about diabetes and why patients are being hit so hard with COVID-19, those folks that do have diabetes. And that's really my first question here to you, Dr. Amar Kapur. So if you could, I'd love for you to share with us, why are people who have diabetes just running into complications with this virus that's going on right now?
Well, first of all, thanks for having me here. Diabetes is a complicated disease. It affects our bodies in a number of ways, and it causes damage across the entire body, starting with kidney, our nerves. Usually a lot of folks with diabetes will also be complaining about nerve damage and not being able to feel things in their feet. So it really kind of hits everything. Overall, when you take into account something like COVID-19, which is ravaging across the country and the world as a whole, what happens with diabetes is that because of that damage to all of your body in various organ systems, it leaves you more vulnerable to other chronic diseases. And that includes the COVID-19. So it's not a chronic disease, but it's an opportunistic infection. So much like the flu or pneumonia or shingles, these are all things that we caution our diabetic patients against and to try to take the most amount of precautions against. So COVID-19 lines up right with those. It's a coronavirus. It's the same thing that causes the common cold in general. So if you can protect yourself against it in general, it will also help you just specifically for COVID-19 as well.
And you talked about diabetes, and we're seeing more and more people with type 2 today, are we not? And what are some of the things that, we can really, offer to our listeners to, do to, protect themselves from getting diabetes? I mean, it's, everything you see today and certainly in the past, you see people, foods are being supersized, and a lot of people are taking in a lot of sugar. And, I think, eating a healthy diet, and again, I'm not a physician, and I try to practice really good, health and choices when it comes to eating foods. But I think, and again, you're the doctor. I mean, I would say that you would think that eating right and exercise are really key ingredients to staving off this disease known as diabetes.
I mean, honestly, that really is all it is to it. When you want to boil it down to its simplicity, how do you prevent diabetes type 2, right? Type 1 diabetes, you really can't prevent that. That's kind of luck of the draw, and that's genetics. There's not a lot you can do about that. Type 2 is easily preventable if you do the right thing. If you take myself, for example, my ethnic background is East Indian, right? So we have that trifecta, as we like to call it. My parents have and are at risk of high cholesterol, high blood pressure, and diabetes. I'm at risk for all those things too, just purely because of my genetics. But if I eat well and I exercise on a regular basis, it lowers my risks of those tremendously. And that's the same advice I give to all of my patients. It's the reason why we check you on a yearly basis to see what your blood sugar is at, to see how you're doing overall, and said, you know what, you're kind of creeping up there. And we all recognize that COVID-19 has done everything, that has done a lot of things to kind of keep us all down and quarantined, and we are not doing as much as we used to. A lot of us are not as active as we have been in the past. We're jokingly calling it the COVID-15 that you've gained over the past, several months. Well, it's not even several months anymore. It's now been
9 months.
9 months, really.
You could have had a baby in this time, right?
Well, yeah. I mean, my baby was born in March. So,
there you go.
It's been hard. It's been really hard. And I get it. And it's also, we're in Arizona, right? So you got to also take into account, it's Arizona. The gyms are closed. It's July. How am I supposed to be able to maintain my weight and exercise habits? If you have a pool, great. Get in the pool, do a bunch of laps. Not everyone who has a pool that's amenable to doing laps, right? You got to make do with what you can. Thankfully, now we're in the wintertime. You can go out and hike. Go out, hike responsibly. Stay away from other people. Keep your mask on when you're doing that. You can most definitely exercise with a mask on. It's not, the concerns about, I can't breathe with a mask on. That's not actually true. There's hundreds of thousands of healthcare professionals around the world. Every single day, we wear a mask for COVID, for other things.
And sometimes for as much as 12 hours at a time. Absolutely.
So, when it comes down to it, it is, yes, exercise. The other component is diet. Everyone's been on the sourdough starter kick, right, for the past 9 months. There's no reason why you can't take up a healthier form of cooking. We're not eating out as much. There's not as much, ideally, fast food, right? Because we're not going anywhere. And some places are also not actually open. So now's the time to pick up those healthy eating habits, those healthy eating routines, and the cooking styles. Where everyone's at home. It's something you can do as a family affair too.
Right. And I think a lot of people don't really realize when you turn that switch on your autoimmune. And certainly, I have a little bit of knowledge because my father has diabetes, and I, certainly have a predisposition because I have genetically, my father and my grandmother had it. I understand that, when you go in for testing for A1C level, that if you are between, I think it's 5.7 and 6.4, you're pre-diabetic, and then anything over 6.4, you have diabetes. And certainly for me, I'm always sharing my own health here on the radio. I've been in that 5.4 to 5.6 range, and I try to make sure I don't even get into that pre-diabetes side. But I don't think people really realize how once you do switch that autoimmune, how it really changes your life. And I know we have maybe about another minute before we break to go into our second half, but can you share with us, how your life does change once that trigger is switched?
Think about your favorite foods. Can't eat it as much as you want to, right? Think about your overall health status. If something as basic as, like I was saying, if you start losing sensation in your legs and your feet, you step on something, it gets infected, you end up losing your foot, all because of diabetes. It's a snowball. Now you're not walking around as much as you used to be able to. These are small, simple things that you can change in the beginning to really have a huge snowball effect later on in your life of like, oh gosh, if I had just, kind of been a little bit more careful with how much cake I eat on a regular basis, then I would be able to still be able to walk around. And this happens every day. I see it every day in my clinic. I see it in my parents. I see it in my family members. It's like, look, we're all at higher risk. This is just how it is. We eat better, eat healthier, exercise more. It has so many better effects, not just diabetes. It hits everything in our lives.
And so true. I mean, it hits everything in our lives, but it affects every single organ too. I mean, you're talking about your feet, but I mean, it affects your heart, it affects your brain, it affects everything in your body.
Absolutely.
Well, we got a little bit of music taking us out. Amar, I really appreciate you walking us through this. When we come back, I want to talk more about diabetes. I want to talk about prevention. I want to talk about, this virus and how it may be playing havoc on those that do have diabetes. And then in the second half, we'll have Rich talk about things that we can do to make the most of the holiday season and really amp up and pick up our moods, if you would. You're listening to Health Futures. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning into the program, we are in our second segment, and I have got in the studio, actually coming in virtually as well as on the phone, I've got Amar Kapur, Dr. Amar Kapur. He's a primary care physician with the 4C Medical Group, and I also have, which is now, by the way, part of OptumCare Arizona, and I've also got Rich Crislip. He's the Director of Behavioral Health for OptumCare Arizona. And if you missed our first segment, you can catch it up on our website at cypresshomecare.com. Click on the media button, third button down is radio show, and you can catch this program and many, many more. So, Amar, we were talking about diabetes and what has this pandemic done to folks that have it, and certainly you did review and share with our audience that some of these folks have been hit pretty hard with this, and we also talked about in the first segment about what you can do to prevent it, and we talked about the blood test A1C. The pre-diabetic range is 5.7 to 6.4, and then anything over 6.4, you're in the diabetic range, and certainly we talked about the autoimmune deficiency. Once you hit that trigger, you've pretty much hit it for life, and what we should do to prevent it. And prevention is certainly something I'm sure that you and certainly OptumCare Arizona is really advocating for their patients and their members to try to prevent, obviously, diabetes. And we're talking about type 2. You talked about in the first segment, too, that genetically, if you have type 1 diabetes, it's in your genetic code, and there's not a whole lot you can do to prevent that, but type 2 is something that is preventable. Is that correct?
Yeah, absolutely. Like I was saying, type 1 diabetes, that's a bad draw. That's a bad hand. You can't do much for it. The best you can do is manage it well, right?
Mm-hmm.
There's definitely type 1 diabetics out there who are phenomenal and doing well and succeeding and thriving in their lives and their jobs, and are leading healthy and happy lives. Absolutely. I can name a couple who have definitely gotten it. So,
and through through technology too. I mean, you think about
oh
now
yeah,
now you can have a pump, an insulin pump, and you don't have to be injecting yourself. A lot has changed, hasn't it?
absolutely, absolutely. I mean, like the technology, like you were saying, it's caught up so much. Now I see folks walking around. It's plugged into their smartphone. That didn't exist 10 years ago. If it did, it was rudimentary. It was hard to use. Not 10 years ago, not everyone had a smartphone. Now it's almost impossible to find a quote unquote dumb phone, right? Like
Right.
you go to the store, it's like I just want a flip phone. It's so hard to get those now. But the technology is around us everywhere, and it makes it easier to get to the information and that kind of feedback of, okay, that cookie really did spike my blood sugar. I need to watch it better and watch it more carefully. Um, the technology has gotten to the point also that like I was saying, since it's everywhere, it's easy for folks to use. Sometimes it's very, very difficult to kind of with the older monitors, older models, just to get them to pay attention to what it was telling them. Now it's like again on their smartphone, it's a notification. Boom, we're already looking at those all day long. It's much more easier and intuitive for folks to handle.
And I think I shared with you before we started the show, my dad, and I shared that in the first segment, has diabetes, and he's got type 2. And you talk about technology. He's using this Libra 2, which is a thing that he puts on his arm, and he just holds a little monitor to it, and he can see where his blood sugar is, and he can, really determine how much insulin he does need to be able to stay in a good range, if you would. And he does know when that his blood sugar drops, and he certainly knows when it's too high. And I think the point that we talked about in the first segment, talking about prevention, I think that message really needs to be driven home to people, because once you flip that switch, you are going to be at the mercy of the things you eat and the lack of movement, or the amount of movement you have in terms of how much you titrate your insulin intake.
Absolutely, there is no cure. There is no cure for diabetes. You can control it, but it's still there. So, if you can prevent it in the first place, prevent any of that damage. And we were kind of joking. It's like, gosh, you're talking about people's feet, and we're worried about their heart and kidneys and everything else. And realistically, I look at a person, you ground up, you're walking around all day, every day. If you can prevent damage to any part of your body, your feet being the first thing you do, you wake up out of bed, you step up and out of bed, you can't do that always. You have to watch out. You have to be cautious about what you're eating. And it's not a culture of fear by any means. Diabetics, pre-diabetics, you and I, just wandering around about our daily days, that's fine. There's no issues with us on a regular basis. You want to have a burger and fries? Great. Have a burger and fries. Don't have it every single day. That's all we ask is moderation. Moderation is always the best. There's a ton of different diets out there. There's a ton of different lifestyle choices that you can do. Honestly, the easiest one to follow is one of moderation. I'm never going to tell a diabetic you can never have cake again for your birthday, but I will tell them don't eat the whole cake.
Well, the interesting thing, too, is you mentioned in the first segment about the fact that here we are in a pandemic, and a lot of us are staying at home. We're eating at home. We're not going out to fast food restaurants. That the problem we have with going to restaurants is we don't know what they're putting in our food. And
Right.
here, when you're cooking at home, you can determine what you're putting in, and you can certainly cut back on the amount of sugar and cut back on some of the things that might be triggers to increase your sugar level, because it's not just sugar intake, it's any carbohydrate that you take in could produce sugar.
Correct.
once you bring it in.
Correct. Yeah, I mean it's also when you are at home, you are able to control, like you said, the amount of things that you're putting in, but it's also you're making it. You're making the bag of pasta, right? But you don't have to eat the whole bag of pasta. You can save it. You can put it in the fridge. You can split it amongst your family, whoever you're cooking with. So it's again, that's where it comes into that moderation and control aspect of, sure, you can eat the same thing that you can get at a restaurant, but yes, you will can make it healthier. You can make other options. They have, let's take the pasta example for one. They have different alternative flours. They have wheat flour versus the other ones. We have, gosh, I was at Costco the other day and I think I saw a cauliflower pasta.
There is.
They have
Yes.
they have all sorts of different options available to you. Do you have to do that all the time? No, but again, that's what I keep saying. This is a lifestyle change. You have to basically take things in moderation and don't go overboard.
So as we wind up our first half, I just want to have you leave with us. How has OptumCare Arizona embraced telemedicine, especially with diabetics and people who are dealing with diabetes?
Well, telemedicine is really nice because normally you come and see me at the clinic. I talk to you about your A1C, but I talk about your medications. We kind of go over all that, and then at the end of our scheduled 15 minutes, I briefly ask, "How's your diet going?" You say, "Doc, it's great, no problem. I'm exercising all the time and I'm eating well." Well, I'm looking at your numbers and I know that's not true, so we can kind of talk more about it next time, right? That's how a normal face-to-face 15-minute conversation goes. Well, when I'm doing telemedicine with you, I'm not doing a physical exam on you because I really can't do that over a video. But I can say, hey, you know what? You're sitting in your kitchen. Let me see what you've got. Let's see what's going around. And then when I see that you've got 5 bags of sugar there and you have nothing healthy to cook with, or you're, those are the options that I can use in for telehealth. It really lets us step into our patient's home.
Dr. Amar Kapur, we have to break now. We're at halftime. We'll be right back. You're listening to Health Futures. Thank you so much. Stick around for our second half if you would.
Being in control of your money provides freedom. Learn how to make it, spend it, and invest it.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, I've got OptumCare Arizona here in the studio. I've got Dr. Kapur, and I've got Rich Crislip from OptumCare Arizona. And when we were talking in our second segment, I was talking to Dr. Kapur, and we were talking about telemedicine. And I really want to finish that off before I bring in Rich and really talk about seeing your patient in the environment that they live in and how important that is for you as a professional. And certainly it is important for patients too, because they want you to see where they live. And a lot of times they want to show you their pets and their things that they may have accumulated over the years. So I'd love for you to finish that. We really abruptly finished that second segment and cut right into halftime.
Sure. Yeah. Telemedicine and telehealth, OptumCare has done a really good job of it, and 4C's embraced it, and in a rapid time, right? Like no one knew what Zoom was 6 months ago. We all know what Zoom is now, right? So we're all using various platforms. 4C is using a HIPAA-compliant platform, so that way you can not be afraid that your health information is being leaked to, your neighbors or anything like that. And doing that, using that technology of being able to step into someone's home, of being able to say, hey, here we are, we're talking face to face. Yes, we're going to talk about your concerns about your medication, but because the physical exam portion is not there, because can't do that virtually, right? But I can now in turn spend more time talking about your family, talking about what's going on, taking a look inside your home and seeing what is good for you and what is bad for you, what is something that you walk by every single day in your own home and you don't give it a second thought. And then I'll see it and say, oh, you probably should move that. Or what about, why do you have that? Or, we're talking about trying to eat healthy, but let me go, what kind of oil are you using? Simple, small things like that. And I have those conversations with patients all the time of, yeah, no, I cook all the time. Great. Okay, let's see what you got. You don't even have a pan to cook with. What are you talking about? Those are simple things that people, it's your own home, right? It's your environment. It's your routine. You don't even think about it. But when I get to come in and take a peek at it, that's an opportunity for me to help and change things around for you.
And in home care, that's what we see. I mean, when we go into the home, I mean, we get a chance to see them as they are. And, one of the things we want to do is we want to do a home safety assessment when we go in. And,
oh, yeah.
And one of the things we do is we look for, obviously things that could lead to falls. But, we also take a look in their refrigerator, and we want to see what's in there. And a lot of times, believe it or not, I'm sure you believe it, is, we find expired foods. We see, stuff that is not nutritious. We'll see ice cream and all these other things, and nothing that really is healthy. And you can really get a good sense of how somebody is living by getting a view in their home. And Dr. Kapur, I wanted you to share that with our audience. I mean, that is so important. And I think that's one of the doors that have been really open with telemedicine, is you get to see your patients as they are in their homes, and how important that
Absolutely.
is. Well, listen, I want to punt it over. Great metaphor, right, Rich? As we are in football season, tips to help manage holiday stress and emotions. And Rich is the director of behavioral health at OptumCare Arizona, and Rich has been a repeat visitor here to our show. And I couldn't think of a better time here, December 4th, as we get ready for the holidays, to really suggest some tips to our listeners in terms of preparing for the holidays, especially during a pandemic.
Yeah, it's the first time for all of us, a pandemic Christmas. I don't think I've ever used that phrase in when I'm talking. So, yeah, thanks for having me on again, Bob. It's good to be here. And
it's good to see you.
The thing was that holiday blues was kind of an issue before the pandemic. I mean, it was oftentimes I've come on shows like that. Your show's talking about this. Probably a couple of years ago, we may have done this, talking about how to prevent holiday blues. So now let's add a pandemic on top of it. So it can be harder, but it can also, there's always opportunities to build hope and build new, build new habits and hobbies and explore opportunities that were never there. Opens your mind a little bit sometimes.
What's interesting is that, we as a country, and certainly as a world, as we learn more about this pandemic, we all often heard about these super spreader events, right? I mean, that's what we heard about, whether they be these political campaigns, whether they be these concerts. But I think the thing that we're learning now is these spreading events are these intimate family get-togethers. And, Americans are getting very fatigued, if you would, from this pandemic. And I think we're letting our guard down over Thanksgiving. And certainly, I'd love to hear from you, Rich, in terms of how do we not let our guard down here during the Christmas holiday and the Hanukkah holiday and the New Year's. I mean, we really need to keep our family members, at bay, so to speak, isolated, right? How do we do this?
Yeah. Well, it's easy to think that now is forever. And I think that if people can kind of just come to terms with the ideas, like, all right, let's just once more, this is short term. We need to do maybe months do seem like long, but they're really not long, and I think that when you get fatigued, we're in our 9th month of this, and now we all had hoped that it would be manageable by Christmas, and it's not. So expectations aren't met, and there's that fatigue factor. But we just have to kind of hang in there for a little bit longer.
Well, you have to hang in there a little bit longer, but I also think that there's that false sense of security that, I'm going to bring my brother in, I'm going to bring my son or daughter home. It's just them. Yeah. They're okay. They say they haven't been around people. I mean, I think that's where our biggest challenge is. I mean, it's no longer these super spreader events. It's these little micro get-togethers. And and we have to be able to tell Americans, we're almost there. We have a vaccine that is coming, right? So, we're almost at that end line. Just be patient. Another 90 days, another 120 days. It's not going to kill you, right?
Well, we're Americans. We like our freedom of movement. It's just how we are. And I get it. I think it's a hard. It's really this is very, very difficult. This is 2020. My goodness, glad to have this one in the rearview mirror pretty
No
soon
kidding.
here. Because it's not just, there's been so many pressures, and in some ways it's almost like, why don't we just take this time to have a big relaxation time and take a big deep breath on our own, and yeah, isolate a little bit more, but take the opportunities. Like, sometimes the holidays can be full of hustle and bustle. Why not just have this kind of slow, kind of easy going, and more, whatever you do to get into the other aspects of the holidays that we might miss because of the hustle and bustle of social events and things, is that maybe look for the opportunities to grow. And if each person can always do that, then we'll be in better shape.
Well, I think the hard thing is that the holidays are difficult enough as it is. And look, Rich, you and I have talked about this here on the show. And I mean, a lot of times, people are experiencing loss. And I'm talking about loss before this pandemic. They've lost, their mother, their father, even a child. And, it's really hard to come together during Christmas because it brings back some of those memories, and it just brings up these emotions of that loss that you've experienced. But now you combine that with COVID and this pandemic, it just makes things even more challenging.
Yeah, no, I mean, there's so many challenges, and I think we all should kind of just say that, that we have been through a lot, and we do need to take care of ourselves. And part of that is taking care of your mind and your mood, because that's taken a hit too. All the stressors that have been going on. It's funny. We knew that social isolation was going to be hard. We knew that was an issue in healthcare. We knew that was an issue with older folks and being alone and being isolated. Well, now we're all kind of in that boat, and I think it's now we know that social isolation is hard on a lot of our physical bodies, our emotions, our emotional health, our our cognitive functioning, just everything. It does cause problems, and so we've got to find creative solutions to continue to connect to people, even though we may have to stay separate.
As we wind down this third segment, I mean, that's the thing that breaks my heart, Rich, is that the social isolation was already a challenge for older adults. They say it's the equivalent of smoking 15 cigarettes a day, and we have a lot of older adults that have moved into these long-term care communities, and they moved into them for the ability to socialize, play cards, to go to the dining, and do all the things that they can do with their peers and some of their friends that they've moved in, and now they're isolated to the four walls that they're stuck with. And that has been a real big challenge. When we come back in the fourth segment, I'd love for you to maybe give us some tips that we can help kind of fend off those holiday blues during this, pandemic that we're dealing with. It's already hard enough. Like I said, when you're dealing with loss, and these holiday moments kind of, bring back those feelings of loss and making that hard. So I'm looking to you to help us through this, Rich. So stick around. We got one more segment. I've got Rich Crislip from OptumCare, Arizona coming back. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in our fourth segment. I've got OptumCare Arizona in the studio. I've got Dr. Kapur. And I've got Rich Crislip. We are talking about the holidays and really trying to make the most of them during a pandemic. And emotionally, and Rich has been on the show before talking about how challenging it is with the holidays, as it is dealing with the emotions that sometimes get stirred up, especially when you're experiencing loss. And, how those, memories come up and they just make those feelings even worse for folks. But, now we're dealing with the pandemic, and certainly I would love to just turn to Rich and say, okay, one of the things we did talk about in the third segment is protecting your bubble, and really it's no longer super spreader events. It's, even your family members could be ones that could bring this virus into your home. And how do you maintain the holidays, the spirit of the holidays, and be able to do that and not do it in person. And Dr. Kapur, you're welcome to chime in as well. So please, Rich, how do we do this?
Yeah, no, I mean, and this is where it gets really hard because, when you start to experience grief, number one is that you kind of got to watch out for yourself because, and those around you that are close. Now, we're all going to be suffering from stress-related stuff. We're all going to be a little bit more irritable, angry, maybe a little bit moodier just because of the pressure of this last year. And the isolation and the things that are being asked for, stay away from loved ones, things like that. That's hard stuff to bear. It's easy to say, hard to bear. The reality of it is very difficult. So, you have to kind of prepare for it. You have to say, okay, how do we do the Zoom stuff? How do we schedule family events? How do we create these kind of interim little holiday traditions within what pandemic traditions? How can we make this one memorable that in 2 years when we look back, we can say, wow, look what we did during that time to stay together, to stay loving together. We're not losing each other. There's opportunities.
And like I said in the third segment, I mean, we're almost there. I mean, we've experienced 9 months. How do we get through the next 90 to 120 days? And get through so people start getting vaccinated and we start maybe curbing the spread, so to speak.
Well, you got to take care of your mind. Doing relaxation and meditation, just every day doing a lot of deep breathing and settling yourself down and quieting your thoughts and doing that repairing, that's really good for the body, just that progressive daily relaxation, 5-10 minutes a day.
Is there a time of day that you recommend that, Rich? Is that morning? Should we do that in the middle of the day, or should we do morning, middle day, and in the evening? What do you recommend?
I would say every time you think of it, actually, if you really think of, every time that you start to get irritated, that you just do 15 quick deep breaths and settle yourself down, but also doing it, whatever works for you. It doesn't really matter as long as you spend time, intentionally just calming yourself down through simple deep breathing is one of the things that we underestimate. But it is an easy thing to do every day to settle ourselves down. And then exercising, getting rid of all that cortisol and getting your oxygenating your muscles and deep breathing and all that. I mean, that just exercise is like one of the number one things you can do for your mood. It's like the number one mood enhancer we have out there for us is exercise.
And also prevent diabetes, right, Dr. Kapur?
And also
absolutely, absolutely.
It absolutely.
It keeps you healthy so many ways.
So here's the question I have, and it's a question for me, and it's a question for so many of our listeners. How do we tell family members, I don't want you to come home. I love you. I want you to stay where you are. How do we do this? Because that's when it gets really hard, because this holiday coming up usually may be the only annual get-together the family gets together. Sometimes it's Christmas and Easter, or it's Passover and Hanukkah, but it's usually maybe this is that marquee holiday. How do we say that and say we still love you? And I know you think you don't have the virus, but and you could be asymptomatic and you have no symptoms, and you could bring it into us and you can make us sick. How do we do this?
For those who choose to do that, then it's really it's protective. That's where the heart is. We're not, so I'm doing it because I love you and I'm protecting you, and hopefully next year we won't be doing this.
Right. No,
because there's really no easy answer. But it comes from a heart of protection, and I think that's hopefully everybody will understand that, and that's what you say.
And I think and it kind of dovetails on what we talked about earlier with Dr. Kapur, telemedicine and using video technology and I'm not talking about eating in front of your laptop or your computer, but maybe playing games, opening up presents. We did our holiday get together with my team, and we did that all virtually, and we played a couple games, and we did our white elephant gift exchange, and we had so much fun with that. I mean, it was almost like we were there, but we weren't, but it was still a lot of fun. I mean, you can still have fun and still engage, right?
Yeah, it's all about, your willingness to do it. You got to clear out the negative thoughts on it. I hate this. This is no good. This is not what I want. You just got to stop talking to yourself that way and say, hey, this is how it is. I'm going to make the best of it. Let's try and find some ways to weather it and make some fun out of it. Let's try to bring joy into this kind of tough spot. Or you can choose to say, no, I hate it. I don't want it. I don't like it. And that's going to really determine how you feel.
I saw you nod before, Dr. Kapur, and when I talked about asymptomatics and their spread, I'm sure you have a lot of knowledge, and you probably see more of this than maybe Rich or I do. People having the RNA and they're not having any symptoms.
Yeah, that's the scary part, right? COVID-19 itself it's a weird virus. It has so many different symptoms. The loss of taste and smell. Sometimes it's temporary, sometimes it's 6-7 months going on, and then you finally get it back. But the scary one is that, yes, your family member, your loved one who you haven't seen for a year, completely healthy, no issues, doesn't have a cough, doesn't even have a sniffle or a dry throat, they could still be infected and they could still be carrying it. And then they come and see you, and then boom, now you have symptoms. We have healthy people who have no symptoms. We have healthy people who have had no symptoms, and then all of a sudden are dying. So that's what makes it scary. So I agree with Rich. It's I love you, and that's why I'm telling you, don't come home. I will see you again next year.
Right. It's a hard thing to do. So we have maybe about 30 seconds. Is there a question I haven't asked, or is there something you want to leave with us? Actually, we got about 10 seconds. Any final remarks?
Thanks again for having me.
Dr. Kapur, Rich Crislip, thank you so much. Thank you, OptumCare Arizona. Make it a great day. We'll be back next Friday.
No place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.